Let's talk about that feeling. That deep, nagging fatigue that sleep just doesn't seem to touch. You know, that weariness deep in your bones that you just kind of brush off as, well, I'm just getting older. It's a really common fear, and for a lot of men, that quiet, persistent exhaustion is actually the very first sign that something is seriously wrong.
Yeah, we've all seen it in the movies, right? The classic heart attack. Crushing chest pain, the arm going numb. But here's the thing, your heart doesn't always scream for help. Sometimes it just whispers. Your body is often sending out these much quieter, more subtle signals first, and learning how to hear them, well, that can be the difference between getting ahead of a problem and finding yourself in a crisis.
I want you to meet Derek, 58 years old, loves tinkering with his old car, loves playing with his grandkids. But lately, even the simple stuff, it just felt like a huge effort. He was tired, just all the time. His ankles would be puffed up by the end of the day, and he did what so many of us do. He just dismissed it. It's just age, it's stress, I'm working too hard.
But what if that exhaustion, that little bit of swelling, that subtle shortness of breath when you take the stairs, what if it isn't just you getting older? What if it's your heart sending a quiet signal that it's struggling to keep up? Okay, let's really get into this. I promise by the time we're done here, you're going to understand these subtle signs, what's really going on, and the absolute most critical steps you need to take.
So let's go back to Derek for a second. His fatigue, this wasn't just, oh, I could use a nap. No, this was a deep physical weakness. We're talking about bending over to tie his shoes and feeling winded, carrying one bag of groceries in from the car feeling like he'd just run a marathon. His entire world was getting smaller, one little activity at a time, and he had no idea why. And this is where it gets so confusing, because look at this list of symptoms. I mean, on their own, they seem so normal, right? But top medical sources, like the Mayo Clinic, they tell us this is the classic list of signs that get missed. That profound fatigue we talked about, the swelling in the legs, doctors call it edema, maybe even a cough that just won't go away, or that really frustrating brain fog. And let's be honest, as men, we are absolute experts at explaining this stuff away. Oh, it's just a tough week, or, I'm not 25 anymore.
For Derek, the real wake-up call, the moment that changed everything, it didn't happen in his chest. It happened on his bathroom scale. One morning, he steps on it and sees that he's gained 4 pounds. Not over a month, since the day before. 4 pounds in 24 hours. He just knew it wasn't fat. He felt heavy, waterlogged. And that was the alarm bell he just couldn't ignore anymore. That was the moment fear finally became stronger than denial, and he picked up the phone and called his doctor.
So Derek makes the call, and this is where his whole understanding of the situation, and maybe yours too, is about to take a huge turn. Because what his doctor started to explain is a really crucial point that almost always gets missed. Heart failure isn't like a heart attack. It's not a sudden event. It's not an on-off switch. It's a gradual condition where the heart's ability to do its job slowly declines over time.
Let's just clear up the single biggest misunderstanding right now. As Johns Hopkins medicine makes very clear, the term heart failure is absolutely terrifying, but it does not mean your heart has failed or is about to just stop working. It simply means the pump isn't working at 100% anymore. It's become less efficient at its job.
So, what's actually happening inside your body when that pump starts to get weaker? Well, the effects start to ripple out through every single system, which is exactly why the symptoms can be so varied and, honestly, so confusing.
Okay, this is truly the best analogy I have ever heard for this. Imagine you have a sump pump in your basement. Its only job is to keep the basement from flooding by pumping out any water that gets in. Your heart does pretty much the same thing for your whole body, just with blood, pumping it out to all your organs and tissues.
So this shows you the core of the problem perfectly. When that sump pump, your heart, gets weak or maybe too stiff, it just can't keep up with the workload. Blood that's coming back to the heart doesn't get pumped out fast enough. And what happens? You get a traffic jam, a backup. Fluid starts to back up into the whole system. That backup, that is called congestion. It's why you hear the term congestive heart failure. It's what causes the fluid in the lungs that makes you feel breathless, and it's what causes that swelling in your legs, your ankles, and even your stomach.
Now, if you're interested in the nitty-gritty, doctors classify this in 2 main ways. Sometimes the heart muscle is just too weak to give a good squeeze. That's a pumping problem. Other times, the muscle has gotten too stiff and it can't relax properly to fill up with blood. That's a filling problem. But here's the most important thing to remember. Either way, the final result is exactly the same. You get that dangerous fluid backup.
Okay, let's follow this to the next stage.
Back in the doctor's office, Derek's story, the fatigue, the swelling, the rapid weight gain, it kicks off a kind of medical investigation. It's not about just one test. It's about gathering clues from a bunch of different places to build a full picture of how his heart is doing its job.
So how in the world do they connect those really subtle symptoms to what's happening with the heart? Well, they have a very specific set of tools, and each one is designed to look at the heart's structure and its function from a totally different angle.
The detective work usually starts with these key tests. An EKG checks the electrical signals, the wiring of the heart. A simple chest X-ray can show them right away if the heart looks bigger than it should, or if there's fluid building up in the lungs. A special blood test called a BNP can measure a hormone that the heart releases when it's under stress. And then there's the big one, what many doctors consider the most important tool, the echocardiogram. Just think of it like a live-action movie of your heart, letting them see exactly how well it's squeezing and pumping.
So once a diagnosis is made, the whole focus shifts from just investigation to active management. This is the point where you go from being a patient to being a partner in your own health. And there is one single tool that is more powerful than any other for watching things day to day.
Now look, everyone is going to get the advice to cut back on salt, and that is absolutely important. But there is a single piece of data, one number, that you can track every single day that gives you the earliest, most concrete warning that things might be headed in the wrong direction.
That number is 2, just 2 pounds.
And here's why that is so critical. According to Johns Hopkins, a sudden weight gain of 2 or more pounds in a single day, or maybe 5 pounds over a week, is not fat. It is fluid. It is the single most reliable at-home signal that congestion is getting worse and that you need to call your doctor's office right away before you find yourself in the emergency room struggling to breathe.
You see what this does? It turns your simple bathroom scale into a critical medical device. Getting in the habit of weighing yourself every single morning, same time, after you use the restroom, before you eat, it is the single most important habit you can build. It gives you and your doctor hard data to work with.
The fact that you're watching this tells me you already take your health more seriously than most men. And knowledge, that's always the first step toward taking back control. So now let's talk about how to use that knowledge to have way more productive conversations with your doctor. Walking into that appointment with a clear game plan can totally change that dynamic. Instead of just sitting there and receiving information, you're actively going after the specific knowledge you need. Here are 3 questions that will get you the most vital information for managing your own condition.
Number 1. What specifically caused my heart failure? Was it years of high blood pressure? A previous, maybe even a silent heart attack? Knowing the root cause helps you understand what you're actually fighting. Number 2. What non-breathing symptoms should I be watching for? This makes the conversation about more than just shortness of breath. It puts the focus on those early subtle signs, like the fatigue, the swelling, and that critical daily weight. And third, which 2 or 3 lifestyle changes are the most crucial for me? This is huge. It helps you cut through all the noise and focus your energy on the things that will have the biggest impact for you. In the end, it really comes down to this. You are not just a bystander in your own health. You are the CEO. Now, of course, this information is just for education. It's not a substitute for professional medical advice from your own clinician, but it is a tool for empowerment. Knowing these signs and knowing what to do about them, that puts you back in the driver's seat. We're going to be covering more topics like this to help men be proactive about their health in future explainers, so make sure you subscribe so you don't miss out.